Okay, good morning to everyone. It is really a pleasure for me to be here in this prestigious university. Thank you very much to Amy for this invitation. It's the first time for me here, and I'm very happy to be here in this very important donkey symposium. And in the first part of my presentation, I would like to introduce my university, the place where I work, and the job we do every day. And I would like to present our Donkey Research Center. And then for maybe about 10 minutes, and then I will present some case in ophthalmology. And we don't still have really donkey ophthalmology field of research. And clinical activity on donkey ophthalmology is very often kept from the knowledge we have in horses. But we will see we have very important difference, anatomical, physiological, and of course therapeutical and diagnostic imaging differences between horses and donkeys. So I'm from Italy. You know where Italy is, of course, and it's a little bit far away, but we are in the center of Italy. My university is a city is called Camerino. It's the city where the university is, but the faculty of veterinary medicine is actually in Matelica. There is a near village to Camerino. It was found in 356, so a very old university, but the faculty, maybe it's better here, the faculty of veterinary medicine was founded in 1826, and under 26. I want to show you, we are here in the center of Italy. We are, as you know, Apennini. They are mountains. They cross throughout Italy in this longitudinally, and so we are among the mountains. I will show you some image of the landscape. So this is the place where the faculty is. The city is called Matelica. We have a didactic pole, small animal department, a large animal department, and here there is the Donkey Research Center we found 7 years ago. This is the oldest city and the faculty, sorry. And now we have some, of course, new facilities. This is the large animal department and the place where students can have lessons, lectures, dissection room, small animal. So this is the usual landscape in the city where we are. And this is the middle-aged village where the university is. So we are in the mountain. We are something like 600 meters on the level of the sea. So this is the usual appearance from my hospital during the winter. So what about donkeys in Italy? We have, sorry, this is in Italian because it's in Italian. And asini is donkeys. We have something like 8,000 donkeys in Italy. And we have several breeds. The smallest is Asinara donkeys. We will see later some picture. We have some cases in Asinara donkeys. They are very nice because they are completely white. And we also have large donkeys, Martina Franca. They both come from Ireland. The Ragusano donkeys is from Sicily. The Asinara donkeys is Asinara is an island, and it's called Asinara. It means something like Donkeyland, and a very, very small island in the north of Sardinia. We will see later. And the Romagnolo and the Martina Franca are the biggest. So what about how we use donkeys? So we have donkeys for sport activities, not so much actually, but somebody use donkeys for sport, this kind of activity. And we use it for therapy with child and with elderly, but also with person with a problem, with a physical problem, and with mental disorders. And they work very well, as you know. And now, starting from 2 years ago, veterinary vets and also behaviorist specialists have to be allowed by the state to work with donkeys and with baby and with elderly people. So you need to have a special license to be allowed to work in this field. And we use a little bit for work, but of course we use for work mules, especially not so frequently we use donkeys, and we also use it as companion animals. They are now, it's really increasing this use of donkeys in Italy, and for trekking, of course, for child especially, for children, and for milk production. We don't drink milk from donkeys, we don't drink it, but it's just for childs. For, as you know, it's the best substitute for as a milk, is much better than cow milk, the goat's milk, and sheep milk for the newborn when they are allergic to the mother milk. So it's the best substitute. So we use it a lot for this, so it will be very, very much controlled. And we also use it for cosmetics purpose, and we have some for products for women, of course. As Popea teach. This is a typical, it's not typical. We can have this farm for milk production, dairy donkeys. They can be kept like this, so in small paddock, and it's something like an intensive farms, but it's not really intensive because they are allowed to go out in the, during the day to go to the pasture, and in the evening they are closed here in this small paddock. They are divided between, it depends from the stage of the pregnancy and the stage of lactation. But most usually, you have this kind of farms. This is also a dairy farm. And they are allowed to stay outside all the day, and they go inside just in the morning, early in the morning, and the afternoon to be milked. And this is another farm for milk production. So what about clinical activity and research at the University of Camerino? We do, I'm an internist, I work with internal medicine, so I'm not a surgeon, but I'm going to present you which kind of surgery we do in our university. This is the first field we work, this is diagnostic, and we tried to check for adrenal glands in donkey. We already did it in the horses, and I read in the program we have tomorrow in the afternoon a really interesting presentation of a case of pheochromocytoma. And I never saw this, so we did this research in donkeys, in normal donkeys, in healthy donkeys, and it will be very interesting to see if the adrenal glands can present some alteration during pheochromocytoma. And we took some measurement, so we need this kind of research. We need a normal range for healthy, for measurement of diagnostic stuff in donkeys, because we don't have it. We have it for horses. We cannot use the same range of horses in horses. So we need this kind of research, as you present now, and to have the measurement of the normal status of donkeys. And in this case, it was really interesting to notice that in donkeys, this is not possible to do it in horses. You can see the right glands that is very cranial in respect to the left one, and you can also see the pancreatic glands in donkeys. It's not possible in horses, and the portal vein. So it could be useful in the future to check for other kind of disease. This is the mammary gland. We use donkeys especially for milk production, and you have to be sure of the health status of the mammary glands. So we have to control. Not only we have to make diagnosis in the mammary glands, but we have to prevent the disease. We know, of course, a lot in cows and in sheep and in goats for this, but we know very, very little in donkeys for this. As you know, the mammary gland in donkeys has not only one gland, as in cows, but they are more than one. Normally are two, sometimes they are three. So you have three holes where the milk came out. So this is very important for the point of view of the clinical evaluation, because the bacteria can come inside, and not all the gland can be infected, but just one part of the gland can be infected. So this is important for the health status of the donkey, for the welfare of the donkey, but also for the quality of the milk that can be contaminated, and you cannot see nothing from just watching the mammary glands, but when you make the analysis of the milk, you can find some alteration. It's very important because the children are going to drink this milk. And we are doing some measurement. This is free glands. This is the teeth. And you can do this. We are doing this measurement, so we establish some range, normal range for this anatomical structure. And we also do research on respiratory disease. This is a case report. We also need case reports in donkeys, of course. It's a guttural pouch mycosis. We had some difference in respect to horses because we saw before a picture, an endoscopy. We do several endoscopy, respiratory endoscopy in donkeys. And you can, in donkeys, for example, it's difficult to make in the intubation before surgery because they have anatomical differences comparing with horse. They have a narrower larynx. And this is very important because in this disease you have swelling on the larynx, you have clots inside because they are bleeding very much. And as you can see here, they lose a lot of blood. And it's a little bit dark, but this is the larynx. This is a big clot coming out from the guttural pouch, left guttural pouch. And this part was really narrow. It was not able to breathe. So I had to do this kind of tracheostomy because it was not able to breathe. This never happened in horses, for example. And I have also, oh, sorry for the marker, should not be here. This is a guttural pouch, and this is the external artery. You will see now the mycotic plaque causing this disaster. Now the donkey is okay. She's pregnant now, and you can see here the mycotic plaque is very small, but is on the external artery, and it can do this kind of disease. So we also are doing research on pharmacology, of course. We know very little about pharmacology in donkeys. We had to study a lot. When we study drugs in donkeys, we discovered that it's very different from horses. So we studied some. This is just for some example on sulpiride. We study on flupirtine, these are anti-inflammatory drugs, metamizole, analgesic drugs. And we found several differences between horses and donkeys. So this is a disease. I don't know if you have this. You have this disease in the U.S., but not so much. I think is Telereque babesia cavalli is pyroplasmosis. Is a protozoal disease. Is transmitted by ticks, and we did a clinical investigation for disease in donkeys, and we found that. So there's always the same history. They are stoical. They doesn't show clinical symptoms of the disease until the disease is very in the final stage. So you have to prevent in donkey before to cure. So we noticed that also in this case, when with the same titers of the protozoal in the blood, donkeys can die. Horses can die, but donkey can just have some. They can produce just a little bit less milk. They can have some weight loss, just a little bit dump. Okay, we also do some orthopedics. We try to do what in horses you cannot do because they are lighter, and you can try to make something sometimes, and you can do it successfully very often. Because they can stay, they are able to be stand as the horse cannot do, and we try to do sometimes. I just show you these 2 or 3 pictures. This is a tibial fracture. It went very well, and this is interesting because we noticed that it was not healing very well. You can see here there is not bone formation. And we use the autologous platelet-rich plasma, so regenerative medicine. So we take blood and we obtain in the lab. It's 1 hour of work in the lab, and you can obtain the platelet-rich plasma, and we inject it in this hole, and it worked very well. Now the horse is okay. This is the report about this autologous platelet-rich plasma, and I think we can use it successfully as in human and as in dogs for the wounds, skin wounds. I think we have to try. I think it will work very, very, very good. We have to try. This is another survey on acquired gastric ulcer. We found a lot of donkeys. You know, in the horses, in athletic horses especially, you can find a gastric ulceration in almost 99% of the horses, and you can also find in donkeys very, very well. They doesn't look so stressed, but they have some not very very deep ulceration, but some erosion you can find in a lot of donkeys. Okay, this is the last one. It's a few days ago, 2 or 3 days ago. It's not my job, but Professor Giuseppe Catone, the Department of Reproduction, he started doing mule and in donkeys some laparoscopic investigation for both for therapeutic purpose, but also for diagnostic purpose. This laparoscopy. This is a mule.